Dr. Jenna from Heart-Based Medicine. I've been asked to do a video on menopause. I've done a series on menopause, but I was also asked to do one on menopause. Now, what is menopause? Menopause is when men's testosterone levels fall. Now, this will happen naturally with age, but unlike women, men's testosterone levels fall slowly. It's not a sudden loss of hormones like we have in women's menopause. But many men have issues with menopause, and it's not well known, nor is it well talked about. Most people talk about a midlife crisis. So in men, we have a midlife crisis. They go out and buy that sports car, they trade in for the younger wife, they start looking for something else to do. That can be a sign of menopause. And it's very commonly known about midlife crises, but we don't actually understand that it's actually a fall in testosterone. So men will continue to produce testosterone throughout their lives, and we know that men can continue to produce sperm up into their 80s. But when testosterone starts to fall, the symptoms that men can get are much like women's symptoms of menopause. They can be things like sexual dysfunction, they can be depression, they can be fatigue, weight gain. Again, very similar to menopause, but men aren't really aware of it. They know about the midlife crisis, that's just when they're aging and they need to go out and do something new, but it may be because their testosterone has fallen. So what do we do when we have menopause? Again, it can be much more gradual, so it may not be recognized right away. You'd want to go and have a visit with your doctor. You'd want to have your testosterone levels checked, as well as other things checked to rule out other causes of fatigue or depression or low mood or sexual dysfunction. We know that there's a lot of diseases that can cause sexual dysfunction, like diabetes, heart disease, high blood pressure. So you want to rule all those things out. Then if you do have a low testosterone, you'd want to discuss that with your doctor. There are herbs that can help. You can do testosterone replacement. There are some risks with that, however, such as increased risk of prostate cancer and increased risk of heart disease. So it's something you'd want to discuss with your doctor, your naturopath, your homeopath, and follow once you have chosen that path. But it is important that we know that menopause does exist and that it is very similar in symptoms to women's menopause, but happens much more gradually. Thanks for listening, and we'll see you again on our next video.